Yes, just a little technical glitch at the beginning here, but this is Dr. Gerald Thompson, and it's always a pleasure to be with you on a Wednesday evening, 8 p.m. Your health matters, and your health does. All those persons, listeners, all those persons who stop me and tell me they listened to me last night or they listened to me on a particular occasion, I appreciate that. Remember that the program is interactive and you can call me anytime on any subject, preferably on the subject of the day. I remember 457-9997 or using WhatsApp 457-9997. And this evening, I want to talk to you and tell you that there are some major breakthroughs taking place with cancer. Now, cancer is such a depressing subject. And I can imagine I could hear people clicking and turning off because they may not want to hear about that. But cancer, I would say, is one of the world's biggest killers. It's in the top 5, heart disease, in some places, still some respiratory diseases in kids. But cancer is up there. And in St. Vincent and the Grenadines, the biggest killer from a cancer point of view is prostate cancer. It's overtaken breast cancer. But each year, 10 million people die from cancer globally. 10 million. That's a lot of people. And scientists have been working to improve on certain things. 1, how to prevent cancer. 2, how to detect it a little earlier. And 3, how to treat it and treat it so that it doesn't come back again. Those 3 elements, 3 elements. How can you prevent it? How can you detect it early? And if you do get it, how do you treat it so that it doesn't come back? And so scientists have definitely been working to improve treatments and diagnosis of cancer. They're now using AI, this thing that we feared. And so AI is big, and anybody who's doing courses and learning AI is important. We're using DNA sequencing. When COVID was coming up, we were taught, DNA, don't deal with them. Boy, I tell you something. There are just a number of diseases that are linked to DNA that has been affected and gone astray for lots of reasons. Exposure to radiation, alcohol, and we are now learning a lot more about DNA. And then what's called about precision treatment, precision oncology, precise treatment, among other therapies. Now, 7 out of 10 cancer deaths worldwide occur in low and middle income countries, like St. Vincent and the Grenadines. 7 out of 10. You would have thought that most of the cancers occur, 7 out of 10 cancer deaths. You would have thought that the cancer deaths would be occurring in more England and America and those places because of all the pollution in the atmosphere and the toxins in the water and all that kind of thing. Well, I tell you the truth, yes, they do occur. But guess what? Because of early detection and precision treatment, these people who develop cancer in the bigger countries don't end up dead. Whereas in low-income countries and middle-income countries, if you don't have the money, if you don't have the health care service that could take care of you at a minimum cost, then you may not have the modern therapies. I mean, sometimes some of the older therapies available. And so that's why in low income and middle income countries, 7 out of the global deaths, the 10 million deaths from cancer occur. 7 million people die in low and middle income countries. Kamal, do you understand that? Huh? That's a really tough thing. Whereas even though persons in bigger countries get cancer, they actually have a better chance of coming out positive from it, you know? So, cancer, what are really the leading causes of death? Well, worldwide, breast cancer, lung cancer, colon cancer, that's cancer of your large bowels in your belly. All these big 3, I would say, they're all expected to grow. I mean, these are among the most common. And while the number of new cancer cases annually is expected to grow by more than 75% in the next 25 years. We're in 2025. By 2050, the amount of cancers are expected to grow by 75%. Now, people living longer. There's better treatment. You've heard what I've said. 7 out of 10 people in low-income countries ain't got a chance, or ain't got a fair chance, I should say. I shouldn't say they ain't got a chance. They ain't got a fair chance. They ain't got a fair chance. But there's some good news, and medical advances have been taking place. And I'm going to try in a very simple way to explain some of these medical advances. Some I have to skip over because they are just too technical. But I want to provide a sense of hope, because I see a nice hospital going up out there at Annesville. It's called an acute care or acute referral hospital. And they are going to be bringing in some experts. And yes, some experts from Cuba, some experts from different parts of the world, from Europe, and so forth, even America, to be working there. And they are going to boost the healthcare system of St. Vincent and Grenadines so that we may now be top rate. I have worked at some of the best hospitals in the world. I remember part of my training was at the Royal Hammersmith Hospital in London. I was only there because my mother had cancer, and they transported her there because that was the only place they were doing that form of treatment. And they allowed me to go there as part of my residency, part of my training. Instead of being at so I was at one of the best places, the Royal Hammersmith Hospital. And then in New York, I was at Columbia Presbyterian, my master's, all that kind of thing there. But no, I basically, was there working with some of the best, and I saw some of the best, University College Hospital, UMD&J in New Jersey. Let me tell you something. The stuff that takes place in these places, I've been tracking what's been happening at some of these places. Some of the leading entities in the world at some of these places and at other places doing some marvelous work, Now, I want to tell you that in England, one of the breakthrough treatments, everybody remembers the vaccines that was used for COVID. And you heard that these vaccines were specially made to target the virus. They were RNA virus vaccines. Everybody remembers that? You probably won't remember that. But they were able to develop these vaccines that were specific to target something on the virus. And the Pfizer vaccine, among a couple of others, were very effective. Now, could you imagine if they're able to use vaccines to target a cancer? A cancer, a specific type of cancer cell that has certain characteristics, and they're able to, well, that is what's happening. And, you know, they say England could soon assess trials of a new vaccine treatment. It's designed to prime the immune system to target cancer cells and reduce the recurrence of the cancer risk. These vaccines are also hoped to produce fewer side effects than the conventional chemotherapy. Everybody knows when people take chemotherapy, these are some toxic chemicals. And the idea is that if you could take these chemicals, whether by injection or by mouth or whatever, and they can kill the cancer. Yeah, they might kill a few normal cells. They might make your hair fall out. They might make you vomit. They might really rip your stomach apart. But at least they've killed the cancer too. So you have to have the side effects along with the good part. You have the side effects along with the good part. If you have ever known someone to have chemotherapy, the type of chemicals used are not nice. But the thing is that they are worse for the cancer cells than for normal human cells. You're hoping that the normal human cells will recover without too much damage. Kamal, you understand what I'm saying there? Yeah? Now, with these cancer vaccines, right, they're talking about giving them without a lot of the side effects of hair falling out and puking and vomiting, you know, your guts out and things of that nature. And so over 200 patients from the UK, Germany, Belgium, Spain, and throughout Europe will receive up to about 15 doses of these personalized vaccines in a study to see how they work. Now, it's unclear whether these things work, but these 200 patients, I want to thank you for starting that particular process. And of course, after those 200, they'll probably do an expanded trial with about 3,000 patients and see how that works. But this is how this is how things work. You may say experiment, but they're talking about real work. Now, number two, how about if a test could be done to identify up to 18 early stages of cancer? Now, researchers in the United States have developed a test they say can identify 18 early stage cancers instead of the usual process of, you know, doing biopsies and invasiveness and so forth, which are very costly and time consuming. A company has tested by taking blood from a patient and analyzing the blood protein in that sample. And in a screening of about 440 people already diagnosed with cancer, the test correctly identified 93% of them as being stage 1 cancers in men and 84% in women. Now, the research Researchers believe this finding may pave the way for a more cost-effective, highly accurate multi-cancer screening test. And this can be done at a population scale. In other words, people who don't want it, okay, don't want it. But for those who may want it, taking a simple blood test, not necessarily giving them anything, but taking a blood test can pick up one of 18 different types of cancers that a person may be brewing in the early stage. Remember, cancer often takes a long while to develop. It's like a plane on the runway. It taxis down the runway and it builds up steam and it starts to take off. Before the cancer really takes off, it has to build up some momentum and some speed. What if we pick up the cancer when the plane is at the top of the runway, or when the plane is still at the terminal? You know, we can. That is a fascinating thing. So look out for that test. You know, then how about? I was telling you about the chemotherapy. How sometimes it's horrible. I got to use that word, gross. I've given some chemotherapy to some patients or been part of the process because some special doctors are needed. But, you know, you go there, something to hold a patient's hand, guide a patient, encourage a patient, you know? Because when you start telling patients about how bad the chemotherapy, some of them say, nah, me not take that. I'm not taking that. And you got to be there sometimes and say, listen, take it. You know, yes, it'll make you feel sick. Yes, it'll make your hair drop out. Yes, it'll make your bowels just go crazy. That's hard to convince a patient to do. But you see, but you may come out of this alive. You may come out of this with the cancer gone and your other normal cells could recover. Your hair could go back. You understand? You know what I mean? So much people take a haircut and shave off their hair, then they grow back. Oh, what's the big deal? You know what I mean? And if you take something funny, you can vomit for a long time. I know Medicaid, I know stuff you don't like. But if you eat some rotten meat and some rotten fruit and so forth, it'll make you vomit too. All right? Right. So in England, again, the National Health Service is trying to be the first in the world to make use of a cancer treatment injection. A cancer treatment injection, which takes just 7 minutes to administer, you know, rather than the current time of up to hours and days of chemotherapy, to have the same drug via intravenous injection. How this will not only speed up the treatment process of patient, but also free up time of medical professional. So this particular process is there's two very important drugs now being used in chemotherapy. These drugs, right? I'm not going to even mention their names, right? But these drugs treat cancers, including lung cancer and breast cancer. And it's expected that as these patients are now able to get these medications intravenously, it's going to speed up the process and so on. Now, another important measure, I'm watching the time, another important measure, right, is what we call precision oncology. Oh gosh, I hate saying that term. That sounds real technical, doesn't it? Come on, eh? That sounds real. But this is one of the best new weapons to defeat cancer. One of the best new weapons to defeat cancer. And this is some treatment that's really coming out of China. This involves studying the genetic makeup of a particular cancer tumor in individuals' patients. Imagine what I'm saying to you. Think about this. If a tailor was to make a suit for you, he will measure your waist, measure your shoulders, measure your legs, and so forth, and build a suit that fits you. If you are 250 pounds, he could build a suit for you. If you are only 150 pounds, he could build a different type of suit, a slimmer suit for you. Well, this cancer treatment is that it's being tailored for you, the cancer that you have. And so they're able to take that a biopsy of the cancer, find out its characteristics, and design the treatment based on a cancer. Now, that's really advanced. That's really advanced. A long time before St. Vincent gets anything like that. But for those people who might be able to travel or so, or living in this part of the world, but have insurance and things like that, these things may become mainstream. But 13,000 tumor samples in the UK in particular have been successfully analyzed so that they understand the DNA, the genome, they're saying, so that they could better target the patient. This stuff is really technical, but I want to say it is really important. And I'm trying to explain it to you. Now, number 5, they're using artificial intelligence in the fight against cancer. In India, they indicated that partners are using these emerging technologies like artificial intelligence and machine learning to transform the way in which we take care of cancer. For example, artificial intelligence-based risk can help screen for common cancers like breast cancer, leading to early diagnosis. So this is something that is a little bit more theoretical, but I think that it's going to be important. Now, number 6, and I think we might take a little break after this one, but a greater prediction of the outcomes, the capability. Lung cancer kills more people in the US yearly than the next 3 deadliest cancers. Do you hear that? We're lucky in St. Vincent that we don't have a lot of lung cancer. But lung cancer kills more people in the United States yearly than the next 3 deadliest cancers combined, breast, prostate, and so on. Believe that? And that's largely because, for a lot of reasons, in those countries, the air ain't too nice. The air in New York, the air in California, the air in Chicago. I ain't talking about being out in the prairies and so in Kansas. And of course, if you're in Rose Hall and you're in Fancy and nowhere, you are experiencing some clean, fresh air. You're not getting the kind of toxins in the air, the particles, and so that folks in the US would be getting. And so it is it's notoriously hard to detect the early stages of disease with just like X-rays alone and scans like CAT scan. They got to be really good. And the size of the tumors have to be really big or big enough to be picked up by X-rays or CAT scans or so, the various scans. However, again, technology seemed to have developed another artificial intelligence learning model to predict a person's likelihood of developing lung cancer up to 6 years in advance, via a low dose type of CAT scan. Now, I'm looking forward that when Arnesville Hospital is built, they're getting in some of the latest CAT scans, they've said, and maybe it won't be one of these AI generating CAT scans. The technology may be just too expensive for us to get that. But it is going to be, I'm just kind of giving you a taste of what's coming down the pipe. And I am still saying it. Remember 3 things: prevention, early detection, and treatment for a cure. Even if we get a CAT scan, this AI generation CAT scan, in 5 years' time, 10 years' time, during those 10 years, you have to make sure that you prevent your cancer from developing. Prevention. In this case, prevention is better than cure, but prevention, you stave it off until we're able to get these things. When the first cell phones came out, people couldn't get them. But later on, we all now have a cell phone. Yeah? We were to do the first flat screen television. We had some big cardboard box televisions and so forth. No, we all have flat screens hanging on the wall and so, right? So I'm saying these things will come. Can you be healthy? Can you be healthy until they arrive? Let's take a break and then we come back.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Now, number 7, a big one. At Cambridge University Hospital in England, right? They have been working on clues that have been evident in the DNA of the cancer. They have analyzed some 12,000 patients with cancer. 12,000 patients with cancer. Imagine that. And they've been finding that the DNA inside the cancer. Okay, let's take this call. We lost it? Sorry about that. We missed the call there. Please call back. The DNA inside the cancer has been affected by certain things. Cancer normally comes because of mutations. Let's take this call. Hello, good evening.
Hello.
Hey, good evening. Yes.
Yes. Dr. Thompson?
Yes.
Has not Trump interfered with that medical scheme in the United States and also the other places that they were helping, the ones with HIV, cancer, and I think the other one is TB. Has he not stopped them?
Oh, let me tell you something. Miss Harold, why you have to depress me? Eh?
What's that?
Why do you have to depress me this evening? Eh?
Oh, forgive me, please.
because you're absolutely right. Some groundbreaking research that I'm talking about, a number of these things have been stopped, at least in the United States. Now,
I will listen, Dr. Thompson, I'll listen to you off here. Huh?
Yes, yeah, thank you. Sorry, let me apologize, Ms. Howard, for me giving that response. But she stepped on a corn there. She stepped on my scientific corn, right? Now, you notice I've been pointing out the countries where these things have been taking place. I've been saying in England, I've been saying in China, I've been saying in Germany, but sadly, I've also mentioned in the United States. Now, some of the research has come from top universities, but by and large, I know Joe Biden had launched what's called a cancer moon search or moon reach. This is a big leap, that is, to try and find out what is happening with cancer. And a number of the research options have lost their funding, and that's bad. But in this case, clues in the DNA of cancer, this one is taking place at Cambridge University Hospital in England. And of these 12,000 patients, right, that being analyzed, the DNA of the cancer itself was analyzed. It's been revealing some new clues as regards what is actually causing the specific mutations in those cancer cells. And they've been finding some of what we knew, but it is exposure to smoking cigarettes. One. Number two, exposure to ultraviolet light on the skin. Three, internal malfunctions of the cells due to certain chemicals, toxins, or things like that that might actually be in your food or in your environment. And they've been cataloging a number of these things. Very important. These are now serving almost like fingerprints, right? In the diagnosis of what's calling. Think about it. We use fingerprints in a crime scene. Well, we are looking now at the level of mutations in cancer cells, and we could tell what may have caused it. What is the fingerprint of the cause for that cancer having been developed? And they have been really doing a lot of work in terms of the knowledge of cancer. And I'm really pleased with what's going on there at Cambridge University. You know? Now, I want to tell you number 8. You know, when persons have a bump and it looks like a cancer, we sometimes want to do a biopsy. What take a piece of it and look at it under a microscope, you know? And hopefully we can recognize the evidence. We can recognize the picture, you know? What is it? What exactly is it? What type of cancer is it? So biopsies are the main way doctors diagnose cancer. But the process of taking a needle or a knife and cutting into that tissue is invasive and involves removing a section of the tissue from the body, sometimes surgically, so it can be examined in a laboratory. Now, they're doing what's called liquid biopsies. Liquid biopsies. I don't know if you all understand what I'm talking about. Maybe I'm going too technical, right? But there's an easier and less invasive solution, right? Where blood samples can be tested for signs of the cancer itself. And so this is a very important area of development, and more we're seeing. And I know Elliot at the lab, and so they should brace themselves for this sort of thing coming up in the future, being able to detect things, liquid biopsies, without the need to cut it and put a needle into it and all those sort of things, you know? Now, there is one of the big treatments, one of the big type of cancers. I don't know if you all know about blood cancers. There's things like leukemia and lymphoma and all these sort of things. These are cancers of your immune system, the immune cells. Now, a treatment that makes immune cells hunt down and kill cancer cells has now been successful for leukemia patients, right? In other words, we're taking immune cells and we are targeting them by re-injecting them into somebody, and the immune cells will go and attack the cancer cells and destroy it. You know? It's like sending up a drone or sending up a set of drones and so forth. And how do we take immune cells and make them act like drones inside your body to target that particular cell? Clearly, this is something that's highly technical. It has to be accurate. You don't want the drone to go and hit something else, right? You don't want to do it the wrong thing. But basically, this is where a lot of work is now taking place. And so it involves removing the genetically altering immune cells. These are called T cells. We've heard of that before. T cells, right? From the cancer patients. And the altered cells then are made to produce proteins, special proteins, right? Which can recognize and destroy the actual cancer cells. So in other words, this is we know that your body's immune cells may be producing certain proteins to help to kill a cancer. But we could take those immune cells, multiply them, make them produce the same protein, and inject back the protein to go back in and kill it. Now, I've lost you. I know I've lost you there. I've lost you there. But boy, this is something that is it. Now, one of the deadliest cancers, when you hear about it, and I hate to say this, you hear someone has pancreatic cancer, you lose the smile on your face, because pancreatic cancer is one of the deadliest cancers known to man. It is rarely diagnosed before it starts. So when you talk about prevention, that ain't happening with pancreatic cancer. When you pick it up, it suggests that that person has weeks and probably months to live, right? Because pancreatic cancer loves to spread. It loves to spread and has a survival rate of less than 5%. I have not known a pancreatic cancer patient to survive, but apparently there are some who have survived, right? And as I said, less than 5% would survive over 5 years, right? Now, again, at the University of California, San Diego, an American place, right? School of Medicine, scientists developed a test that identified 95% of early pancreatic cancer. Boy, that is big, you know? And many of you may not understand cancers can develop in different parts of the body. Cancer of the breast, cancer of the prostate, cancer of the lungs, cancer in your stomach. But boy, a cancer of the pancreas, which is to the back of your belly, right? You see where the pit of your stomach is right to the back line there. So it you don't get much symptoms. You might get some backache, you might get some things like that, but you think that's by lifting a box or something. So the pancreatic cancer is there brewing, building up. It's hard to detect it early. But boy, they have developed a test. 95% of early pancreatic cancer detection in a study. This is big. The research, which was published recently, explained how they were able to do this. And they did it not just for pancreatic cancer, but ovarian cancer, cancer of the ovaries, cancer of the bladder, right? And this looks like something that may well be used. So scientists are also getting closer to what we would consider as being a cure of pancreatic cancer. I'll tell you, pancreatic cancer is dead. I'm not going to say more on top of this, but I want to say that if these guys could start finding a cure for pancreatic cancer, which this article says they're close to, that's Nobel Prize stuff. That's Nobel Prize stuff, you know? What about a tablet to cut down breast cancer risk? Now, a drug, right, that could reduce the chance of women developing breast cancer is also being tested out of England, right? It will make available, they're going to make it available to over 300,000 women, right? Seen as being the most risk of developing breast cancer. Everybody knows that if you are a woman and your sister or your mother, your grandmother had breast cancer, therefore you may be at an increased risk as well. And so you never know when, you never know if, you never know how this is going to develop, but would you get into a study where taking a tablet could help reduce your risk so that you don't follow your sister or your mother or your grandmother with a breast cancer? You know? Well, 300,000 persons have taken up that challenge and that risk. I know you may not, nobody giving me anything, nobody doing that to me. I'll take my chances, I'll roll a dice. Well, boy, the drug name is anastrozole, and apparently it cuts the level of estrogen that women produce. So blocking this estrogen impact on things like breast cancer. It is a big deal. And so I just wanted to touch this point. The very last one is cervical cancer. And sadly, I'm touching on these things, Kamal, it's not nice. Cancer of the womb, cervical cancer. Do you know a woman's womb, at the tip of it is an area called the cervix, you know? And it's difficult to describe it. The woman's womb is like a little balloon. And right at the tip where you tie the knot, that's the cervix. Now, normally there's no knot there. So that if a woman is going to get pregnant, sperm has to travel up past the cervix into the womb. If a woman's seeing her period, the content of the womb comes out past the cervix. Now that part of the cervix, how have they found? Almost 90-something% of cervical cancer is because of a virus, HPV. And women who've had multiple sex partners, the chances of picking up this HPV virus, the particular type that causes cervical cancer, because there are many HPV viruses, many of them. Some are, don't bother me. Some are mild, some are, you don't have to bother them, but some actually are really not nice, right? And in October 24, researchers announced the biggest breakthrough in cervical cancer treatment for 2 decades in a trial of 32 medical centers from Brazil, India, Italy, Mexico, and the UK again. Researchers showed that giving cervical cancer patients a short course of a tablet before starting the standard treatment reduced the risk of death by 40%, right? It also reduced the risk of cervical cancer returning in by a fair amount. So this particular drug used in this case is not expensive, and so I'm hoping that our oncologists here in the Caribbean, and so we'll start to see this, but cancer of the womb, there has been a big breakthrough. And that's about it for me today. I've gone through a lot of different cancers to tell you that there's a lot that's happening. And if you are from a nation that isn't looking at this stuff, the chances of you dying from cancer is rare. Whereas if you have access to these things, it can significantly have an impact on you being alive. I still start off by saying that prevention is still better than cure. And there are a lot of things that we can do from a prevention point of view to avoid the risk of cancer. But by cancer, you never know who it's going to strike. And even people who are healthy, who've been eating right, and people been doing the right thing. I mentioned breast cancer, just having the genetics, having a sister, a mother who had breast cancer before, right? You have that increased risk too. Same with prostate cancer. And it's really important. So, I mean, it's been a little bit of a depressing subject tonight, but I'm ending it with some good hope that, cervical cancer, there's big news there that we could reduce the risk. We can actually improve the level of cure by almost 50% with the use of some medication, right? That they've now been using. This is good. This is good news. This is good news on cancer. And all the other things I've said may come to St. Vincent in time. Tests that can pick things up early, and other treatments, and so that can assess really how things are going. These are all good things, because as we lose people, as we lose relatives and friends to cancer, it is not the nicest thing. But we also ourselves need to be aware. And that's why I brought up this subject today. And we bounce around from topic to topic deliberately because you all mix it up a bit. And so it isn't a continual university where you're going from one thing to the next. We mix it up deliberately. And I thought that this was the right place. Remember, cancer screening. Women, cervical cancer, you can still get a pap smear. That breast cancer, you should know. You could do self-breast exams, right? Or make sure your boyfriend or significant other, I want to encourage you all to also examine your wife's breast, but or your girlfriend's breast. But they will do it themselves too. But more so, go and get in a mammogram, especially some of the new type of mammograms are going to be very helpful. And there's a schedule of when to have it and when to take it. And then men, prostate, don't get worried about the doctor. I think don't feel abused and so forth. Go, man, get a blood test and check the thing out and so forth, And colon cancer up in Georgetown, the folks, our Cuban friends, people say we must get rid of. We must get rid of our Cuban doctors who are giving us immaculate treatments, improving services and so forth. Get rid of them, But they're going to send doctors from the United States down here? Nah, that happened. Never happened. So I think that as we come to the end of the program, we end a little early. It's on that note that we still have a few. We still have we have a second. Oh, I think we're finished. Thank you very much, ladies and gentlemen. I want to bid you a very special good evening and good night.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m.